I just did the dumbest thing ever. So this is the second time I'll be making this video, partly because, well, actually 100% of the reason is because I just did the video and I forgot to hit capture. So I sat there and talked to myself for like 15 minutes and it wasn't recording. Yeah, I'm so awesome. So anyways, the title of this video today is Healthcare in America, because lately I've been having a lot of problems with the healthcare system in America. Excuse me. Mainly because I go to the doctor like every other week because I'm pregnant. So I'm in the doctor a lot. So, you know, I'm gonna have more problems than the normal person that goes to the doctor, probably. I'm not gonna agree with everything that a doctor says, maybe, I don't know. But it just seems like I've been running into a lot of things lately that I don't really agree with or that I don't feel comfortable with. And I just thought I'd share it with you guys. You guys, give me your insight, tell me how you feel about how you've been treated at the doctor lately, because I personally feel like I've been pushed. Like, every time I go in there, I feel like they put me down, or they're pushing me into something, or, honestly, I feel like if you're going to the doctor for a specific reason other than a checkup, I think that you should have your research done, and you should not really try to self-diagnose yourself, but, at least try to have some common sense of what's going on in your body. So anyways, I'm pregnant, obviously. So that's what's going on in my body. So when I go to the doctor, I know what's going on. But what I mean by I feel like I'm being pushed, like, for example, the flu shot. I don't agree with the flu shot. If you get the flu shot every year, that's awesome. But I'm going to tell you why I don't get the flu shot every year, because I'm not comfortable with the flu shot. It's not that I'm just like, oh, I hate needles or whatever, which I don't like needles, but that's not exactly why I don't get it. I don't get the flu shot because I feel like it's completely useless. Because if you get the flu shot, there's two different kinds. There's a live virus and there's a dead virus. If you get the live virus, when they put it in your body, more than likely, it's going to make you sick anyways. So what that means to me is they're going to give me a shot and I'm going to get sick, or I'm going to not get the shot and take my chances of not getting sick. Why would I want them to put something in my body that's going to make me sick anyways? That makes no sense to me. Or I can get the dead virus, which is just a guess of what they think is going to come. So that's still just another risk. It just means you might get the flu, you might not get the flu, you might get that strain, you might not get that strain. So, I just find it completely pointless. But anyways, so when I went to the doctor last time, I walked in. They asked me if I wanted the flu shot. I blatantly said, no, I don't want the flu shot. And the nurse is like, are you sure? Because if you get the flu, it can be really bad for you and your baby because you're pregnant and your immune system's lower and blah, blah, blah. And again, like I said, I think that you should do research. I think that you should look into things before you just go with the flow. So I told her no, and she keeps on pushing. She keeps on telling me why I should get the flu shot, and I'm like, I don't want the flu shot. And I just feel extremely pressured, and I almost want to be like, fine, just give it to me. If you'll just shut up. Like, lady, seriously? I don't want to sit here and hear about the stupid flu shot all day. So, my honest opinion is that it makes money. So, they're going to try to give it to you. Not like the nurses are trying to make money, but it gets our healthcare system money. So, you know, it benefits them. So anyways, that's not the only problem that I've been having lately. So like I said, being pregnant, I go to the doctor like every other week. So fun. I love going to the doctor. Anyways, so my last doctor, I never met my last doctor. Well, actually I did meet her, not in like my room, like her coming to talk to me and, you know, patient to doctor. It was more like, oh hey, how you doing? I'm your doctor. Bye. She just walked past me in the hallway. That was it. That was all it was. But so every single time I went into the doctor's office, I either saw an RN, an LPN, or a nurse practitioner. What's the point in that? Aren't they supposed to just take my blood pressure and check my urine and check the baby's heartbeat? Isn't that all they do? Because that's what my understanding was. I thought the doctor was supposed to come in, talk to you, ask you what's going on about your body, you know, maybe learn your name even, know something about you, make you feel comfortable, you know, let you talk for a minute, but never happened. Not only that, but, okay, being pregnant, again, and I keep saying that because I'm pregnant and that's pretty much all that's going on here. So I've gained 25 pounds, which is normal, so don't call me a fat ass. So those chairs in that doctor's office were hard and wooden, and I sat there for like 3 hours every single time I went. No lie, no exaggeration. I literally sat there for about 2.5 to 3 hours every time I went, every time. So by the time I got to actually go back there, my back is killing me because it's so comfortable to sit in a hard wooden chair. I would have rather sat on the floor if I didn't look like an idiot. But that's just me. So not just that, but I just felt like a number. Like I said, they didn't know my name, they didn't remember me. I just felt like a number. Like they didn't take the time to care or ask questions or, you know. So anyways, so they randomly called me one day and they're like, hey, so we're gonna have to close our office. And I'm like, are you kidding me? Like, I'm 29 weeks pregnant. Like, what am I gonna do? And they're like, well, the doctor is dying. And I'm like, what? Like, I'm in complete shock. Because first of all, I had just seen this lady, and that was the first time I had seen her throughout the whole pregnancy. She seemed fine, but they said that she'd been having massive strokes and massive heart trouble. Or not massive heart trouble, but heart trouble, whatever. So like the strokes paralyzed her, gave her brain damage, and then the heart trouble that she was having, apparently it was like she was having like a heart blockage maybe, or something like that, heart failure, something really severe, and it was killing her. So they had to close their practitioner completely. So that means I had like a week before they closed the office, before I had to find another doctor to send my papers, before they just didn't exist anymore. So I had a week to go find another doctor. So I go and I find this new doctor, and I ended up having to go to the doctor the day before I go on Christmas break to go visit my family back home in Tennessee. And I have to take, that's like an 11-hour drive. So I was going to the doctor that morning. Right after that, we were leaving to go visit our family. So I go to the doctor. I meet the doctor. She's really nice. I really liked her. She actually did sit down with me and talk to me, you know, ask me questions. And this was the actual doctor that I thought was going to be delivering the baby. And I really liked her, so I was excited. I was like, okay, you know, this maybe this happened for a reason. Not because the doctor was dying, because that's horrible. But that I ended up going to her office because she was really nice to me. And then all of a sudden she says, I want to check you to see if you dilated or do a cervical check on you, which is really weird because usually if you've been pregnant before, you'll know that they usually don't check you to see if you dilated, if they check you at all, because some doctors don't find it necessary. They usually don't check you until you're like 35 or 36 weeks. I was only 30 weeks, so it was really weird. Anyways, so she does the check. She says I'm 2 centimeters dilated, and then she asks me if I've been having contractions. And of course I'm like, no, because if I had been having contractions, I would probably be in labor and delivery. Because I've had a baby before, and I know what they feel like, so yeah. So she insists that she puts me on these monitors, so I sit there for like 2 hours with these 2 monitors on my belly, and by this point I'm freaking out. I'm like, okay, she knows something that I don't know. What's going on? Am I seriously, at 30 weeks, about to have like a 3-pound baby? I'm not going to get to go home, so I call my husband, and it's like this. Oh my god, I'm about to go to labor and delivery, and we're going to have the baby today, and we're not going to get to go home. Except my face is like red and puffy, and there's tears everywhere and mascara everywhere, and I look awesome. Yeah. So he's like, calm down, what's going on? And, I'm like, that's what it sounded like. So anyway, so she comes back in like 2 hours later after I sit on these monitors, and I'm sitting here watching them because they're like sliding off right here, and I know what they look like because I had to do that with my son when I was in labor, when I was in actual labor, so I could tell I wasn't having contractions. So the nurse came in, and she was like, how are you doing? And I'm like, I'm fine. How much longer is this going to take? And she's like, oh, you're done. You're not having contractions. So after 2 hours of sitting there wasting my time, the doctor calls me back in, and she's like, no, you're not having contractions. And I'm thinking in my head, yeah, I kind of figured that. I mean, I didn't feel any contractions. So if my tummy's not tightening and I'm not in pain, what are some other ways you're having contractions? Anyways, so she tells me, I don't want you to go home today, I don't want you to travel, and I'm like, does that mean don't, or you don't want me to? And she's like, well, I can't tell you you can't. So I'm thinking, okay, I'm going home then. So we go home. I'm completely fine. And then she wants me to come back as soon as I get home. So I am scheduled to go to the doctor the day after I get home, which I didn't get home till really late. It was like 11:30, which is late for an old pregnant lady with another baby. And then I have to go to Walmart because Grayson's completely out of formula. So at 11:30 at night, I have to go to Walmart, get the formula, come back, I go to sleep, I'm exhausted, I wake up, and I'm like, okay, I gotta go to my doctor's appointment. And Grayson's still in the bed like, sleeping like a baby. And he never sleeps that late, but he's obviously exhausted. So I'm like, okay, he's exhausted, I'm exhausted, I'm gonna reschedule. So I reschedule, and no problem, they schedule for a few days later. And then I get a call like 5 minutes later, and this nurse, who I have no idea who she is, I've never talked to her in my life, no idea. So she starts griping at me. I mean, acting like I'm her child, and she's about to send me up to my room. Seriously. She's like, first of all, before I tell you what she says, I have to tell you that by this point I have not had my gestational diabetes test because the doctor's office had scheduled me at 29 weeks, which is still a little late. And then they closed their office, so I hadn't gotten one yet because the office closed. So that was what I was scheduled for when I had to reschedule, if that makes any sense. So anyways, I had not had that yet. And I had an ultrasound scheduled because they said the baby was only a couple of ounces behind, and they just wanted to make sure that she was growing properly and that there was no problem with her, which they said the same thing about my son, and he's fine. But anyways, so this nurse calls me, and she says, I'm getting winded. She says, can you please tell me why you rescheduled your appointment? Nosy. And I'm like, okay, well, I had an 11-hour drive last night, and me and my son, which my son's only, well, not even a year old, is really tired, and I'm really tired, so I just thought I could wait a few more days. And she tells me how irresponsible this is and how I should go to my doctor's appointment. And I'm like, too tired to even answer her question or give her a response at all. I'm just like, shut up, I'm going back to sleep. And then she says, you haven't even had your gestational diabetes test yet. And I'm like, okay, I haven't gained like 50 pounds and I feel fine, so I'm pretty sure I don't have gestational diabetes. But that's really not my fault because my doctor was dying, she scheduled it late, then I had to find a new doctor, okay, and then I had to go on vacation because I'm not just going to miss Christmas break unless I feel like my child's life is in danger. Then I will make sure that I am definitely 100% at all my appointments on time if I feel like something is wrong. And then she says, well, you also had an ultrasound, okay? Your baby is very small, and we need to make sure that there's nothing wrong with her. And then I'm like, I've had like 10 ultrasounds. There's nothing wrong with her that we know of, hopefully. I mean, what do you mean? And she's like, well, you just should have came today. And I'm like, okay, do you want me to come in today? I was like, is there something wrong that I need to know about? And she's like, no, you can't come in today. You should have came to your first appointment. And I'm like, okay, well, obviously if there was something wrong, you would have wanted me to come in right now, right away. And she's like, no, that's not what I'm saying. And I'm like, what is the point of your call? If there's nothing wrong, and if you don't want me to come in, what is the point of your phone call? And she's like, I just wanted to let you know that you should make it to your appointments. And I'm like, yes, mother. Okay, like, first of all, I know you should always go to your doctor's appointments, especially when you're pregnant. You should always go. Okay, but because I missed this one appointment, not even just missed it, but rescheduled it, all of a sudden I have all these problems that I didn't even know about? Like, huh? But the thing is that there's no problems, and that she just wanted to complain because I pissed her off because I rescheduled my appointment. And plus, she probably saw it on her file that I'm a young girl. So she's like, okay, well, I'm going to call this girl. And she's probably on drugs. She's probably smoking marijuana as we speak. So I'm going to call her and I'm going to, tell her what I think about her and make sure that she makes her next appointment. Because I'm going to be checking her urine. Give me a break, lady. Like, seriously? This is the problem that I have with our healthcare. I'm not a child. I'm an adult. I feel like I can make my own decisions. I have another child that I have to take care of. Not just the one in my belly, but I have another child. And if I felt like there was something wrong with my child, I'd obviously be at the doctor. Okay? So if any of you have a problem, say it to my face. I have one more thing for you guys. It's a girl. Oh yeah. We're having a baby girl. This is pretty much all the furniture in her room right now. That's it. yeah. So I hope you guys had a great Christmas and a great New Year. And I am 32 weeks pregnant, and I'll show you my belly real quick. And then that's the end of this video. Yep, that's it. 32 weeks. Got possibly 8 weeks to go. Maybe more, maybe less. I don't know. But I'll see you guys soon. Maybe.